Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the high resolution endo mode of the patient that you had requested. The area of interest is the lower right first molar region. There is a crown prosthetic restoration. On the sagittal view, you can see that the root canal treatment has been done and there is a underobturated the under obturation that we can see on the mesial root. On the transaxial view, this is the mesial root. We can see that there are two canals, the mesiobuccal and the mesiolingual. The mesiobuccal is short by approximately 2.6 millimeters, and the the mesiolingual is short by 2.6 millimeters, and the mesiobuccal is short by approximately 2.7 millimeters. We don't see any major radiolucencies. We do, however, see PDL widening around the apex. Moving to the distal canal, this is the distal canal. On the distal canal, we can see that the obturation is short by approximately 2.2 millimeters. We don't see any major cracks or pathologies around this tooth. However, in the interradicular area, there is a slight hypodense area seen here and a little bit of a little hypodense area in the interradicular region, but we cannot certainly say if there are any problems on this section. Moving to the axial section, so this is the crown portion, this is the endodontic portion. We can see the obturation. We don't see any major cracks or any major fractures propagating from the tooth towards the interradicular area, but right here we can see that the obturation is significantly close to the distal portion or the distal border of the mesial root. So this might have a tendency of causing any kind of strip perforations. We don't see any radiolucencies associated with it, but this could be a cause of concern. When we're moving apically, like we mentioned that the apex is slightly underobturated in the mesials, we don't see any discernible canal configuration in the apical 1/3. So the area which is slightly underobturated, we cannot fairly certainly say if there is any particular problem or if the canal is sclerotic in that region or not. Moving back to the axial section, here again we can't see any discernible canal configuration. Just here we can see and this is also moving distally. This here is the apical foramen. We do see a little bit of a ciliar trail here, and we can also see that this is where the distal the mesiobuccal root kind of distalizes towards the apex, but we can't see a discernible connection between this aspect and the aspect seen in the obturation. So this is the CBCT. If you have any further questions, please feel free to reach to our team. Thank you very much.